NCLEX RN Exam Review 2026 questions to reinforce key concepts. Question 1. The client is 2 centimeters dilated. Which of the following statements would the nurse expect her to make? Option A, we have a name picked out for the baby. Option B, I need to push when I have a contraction. Option C, I can't concentrate if anyone is touching me. Option D, when can I get my epidural? The correct answer is option A. We have a name picked out for the baby. In the latent/early phase of labor, 0 to 3 centimeters, clients are typically excited, talkative, and oriented toward future plans for the baby. Question 2. The client is having fetal heart rates of 90 to 110 bpm during the contractions. The first action the nurse should take is: Option A, reposition the monitor. Option B, turn the client to her left side. Option C, ask the client to ambulate. Option D, prepare for delivery. The correct answer is option B, turn the client to her left side. Fetal bradycardia during contractions suggests decreased placental perfusion. Turning the client to the left side maximizes blood flow to the uterus. Question 3. In evaluating the effectiveness of 4-Pitocin for a client with secondary dystocia, the nurse should expect: Option A, a painless delivery. Option B, cervical effacement. Option C, infrequent contractions. Option D, progressive cervical dilation. The correct answer is option D, progressive cervical dilation. The therapeutic goal of Pitocin, oxytocin, in labor is to produce effective contractions that lead to progressive cervical dilation. Question 4. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions? Option A, anticipate the need for a cesarean section. Option B, apply the fetal heart monitor. Option C, place the client in genopectoral position. Option D, perform an ultrasound exam. The correct answer is option A, anticipate the need for a cesarean section. A footling breech carries a high risk of umbilical cord prolapse during labor, often necessitating a cesarean section for safe delivery. Question 5. A vaginal exam reveals the cervix is 4 centimeters dilated, membranes intact, and FHR 160 to 170 bpm. What is the rationale for applying an external fetal monitor? Option A, the cervix is closed. Option B, the membranes are still intact. Option C, the fetal heart tones are within normal limits. Option D, the contractions are intense enough for an internal monitor. The correct answer is option B, the membranes are still intact. Internal monitoring, scalp electrode, requires ruptured membranes. Because the membranes are intact, an external monitor is the appropriate choice. Question 6. Which nursing diagnosis would be most appropriate for the prima gravida as she completes the early phase of labor? Option A, impaired gas exchange. Option B, alteration in placental perfusion. Option C, impaired physical mobility. Option D, potential fluid volume deficit. The correct answer is option D, potential fluid volume deficit. Clients in labor are often NPO or have limited intake while expending significant energy, making them at risk for fluid volume deficit/dehydration. Question 7. At 8 centimeters dilation, the nurse notes late decelerations in a baseline of 165 to 175 bpm. What is the most likely explanation? Option A, the baby is asleep. Option B, the umbilical cord is compressed. Option C, there is a vagal response. Option D, there is uteroplacental insufficiency. The correct answer is option D, there is uteroplacental insufficiency. Late decelerations are a non-reassuring sign caused by uteroplacental insufficiency, meaning the fetus is not receiving enough oxygen during contractions. Question 8. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to: Option A, notify her doctor. Option B, start in 4. Option C, reposition the client. Option D, readjust the monitor. The correct answer is option C, reposition the client. Variable decelerations indicate umbilical cord compression. Changing the mother's position is the first step to relieve pressure on the cord.